Hello everyone. Today's topic is heart failure management. Myself, Dr. Rizza Sadaqat. I have a bachelor's in dentistry and a master's in public health. I have been associated with MyAussieTutor since the past 1.5 years in academic writing. Moving on, let's first of all discuss about what is heart failure and what is its pathophysiology and what are the consequences that the patient face and then its management. Okay, so first of all, heart failure is described as a chronic condition in which the heart doesn't pump blood as well as it should. Heart failure can occur if heart pump system that is systolic or its fill system that is diastolic do not work adequately. There are various types of heart failures, could be either right-sided heart failure or left-sided heart failure. Right-sided heart failure is when the heart's pumping action moves used blood that returns to the heart through the veins through the right atrium into the right ventricle. Right ventricle then pumps the blood back out of the heart into the lungs to be replenished with oxygen. Right-sided or a right ventricular heart failure usually occurs as a result of left-sided failure. It is a consequential heart failure. That is when the left ventricle fails, increased fluid pressure is in effect transferred back through the lungs, ultimately damaging the heart's right side as well. When the right side loses its pumping power, blood backs up in the body's veins. This usually causes swelling or congestion in the legs, ankles, and swelling within the abdomen, such as the GI tract and liver, causing ascites. Left-sided heart failure is when the heart's pumping action moves oxygen-rich blood as it travels from the lungs to the left atrium, then onto the left ventricle, which pumps it to the rest of the body. The left ventricle supplies most of the heart's pumping power, so it's larger than other chambers and essential for normal function. If left-sided or left ventricular heart failure, left side of the heart must work harder to pump the same amount of blood. There are two types of left-sided heart failure. Drug treatments are different for the two types. The two types are heart failure with reduced ejection fraction, it is also called a systolic heart failure. The left ventricle loses its ability to contract normally. The heart can't pump with enough force to push enough blood into the circulation. The other type of left-sided heart failure is heart failure with preserved ejection fraction, also called as diastolic failure or diastolic dysfunction. Left ventricle loses its ability to relax normally because the muscle has become stiff. The heart can't properly fill with blood during the resting period between each beat. Now, as you can see, left-sided and versus right-sided heart failure, I'm going to explain it to you. Left-sided is the most common type of heart failure involving the left ventricle first. Heart loses some of its ability to pump blood out to your body after it has been reoxygenated. Usually, it is caused by coronary artery disease. Right-sided heart failure is a consequence of left-sided heart failure, and it loses some of its ability to move oxygen-depleted blood to the lungs to pick up new oxygen. It is more often caused by left-sided heart failure and can also occur even when the left side of the heart is apparently normal. That is a rarity. Now, in the right-sided heart failure, what happens is that from the right side of the body, the venous returns from the body organ except the lungs. It then failure leads to venous congestion of the body organs because the blood is not being able to pump by the right side of the heart to the lungs for reoxygenation. Normally, the right side pumps the blood into the lungs, but failure happens because of increased pulmonary vascular pressure. So what happens is because of all these two things, failure leads to either venous congestion of the body organ, it is unable to transfer this blood or venous return from all the body organs to the lungs. It is not able to do that, which also causes because of increased pulmonary vascular pressure. It basically causes hepatomegaly, that is cardiac cirrhosis, and increases the JVP. This peripheral venous congestion that happens when the right atrium did not send the blood back, no worries, and failed because blood to stubborn resistant pulmonary system. And right ventricle fails because it is failing to push blood into the stubborn resistant pulmonary system. We can't accept more blood because the body organs cannot accept more blood, and that is why. When that happens, what happens is it increases the jugular venous pressure. It also causes hematomegaly or cardiac cirrhosis, renal failure, azotemia, peripheral edema in the dependent part, that is the foot or the GIT, causing ascites because the body is unable to accept more blood due to peripheral venous congestion. The other thing that happens is because of increased pulmonary vascular pressure, the increase in the pressure in the pulmonary circulation causes chronic lung disease or pulmonale, which is also right-sided heart failure, causes the lungs to work overflow, and also left-sided heart failure, which is the most common cause of the right-sided heart failure. Chronic lung disease, cor pulmonale, and most common cause of right-sided heart failure, left-sided heart failure, because the left side of the heart has stopped working. Okay, moving on. In the left-sided heart failure, what happens is that the left side is responsible to give the venous return from the lungs, but its failure leads to pulmonary congestion and increased pressure. The other part is also that without the left side supplies the body organs with the oxygen and blood, and its failure leads to low oxygen perfusion and hypoxia in the body organs. So basically, what happens is that when the left atrium and the left ventricle give up, it leads to pulmonary congestion, pulmonary edema. which causes a decrease in the increase in the CO2 and a decrease in the oxygen. Every alveoli is then filled with edema fluid. Gaseous exchange becomes impossible and the breathing gets tougher and tougher. The lungs become heavy and wet, that is pulmonary congestion. Most commonly affected organ in left-sided heart failure is the lung, which causes pulmonary congestion and pulmonary edema, which leads to the symptoms of dyspnea, orthopnea, and paroxysmal nocturnal dyspnea in patients. Dyspnea, difficulty in breathing; orthopnea, difficulty in breathing while lying down, getting up; and paroxysmal nocturnal dyspnea is at the night when the patient suddenly gets up and difficulty in breathing. So all of this causes pulmonary hypertension, congestion, and pulmonary edema because of increased pulmonary venous pressure, because the left atrium is unable to handle the venous return and cannot process it, and they send it back to the lungs. So when it goes back to the lungs, it causes pulmonary congestion, increase in CO2 and decrease in O2 in the lung, the alveoli, and fill it with edematous fluid, causing dyspnea, orthopnea, and paroxysmal nocturnal dyspnea in the patients. Now, the other aspect in a left-sided heart failure is that when you're supplying body organs, it fails to supply or leads to low organ perfusion and hypoxia when the heart is unable to work. So it faces systemic resistance, which causes hypoxemic ischemic encephalopathy. Without oxygen, the body is as good as dead. Hypoxemic ischemic encephalopathy, systemic resistance in the body, which further starts affecting the right side of the heart, which we have already discussed in the previous slide, causing right-sided heart failure as well as a consequence of left-sided heart failure. Moving on, clinical manifestations of each of these heart failures. What are they and how do they look like? In a right-sided heart failure, fatigue, peripheral venous pressure is highly increased, ascites because of congestion, this collection of fluid in the body, enlarged liver and spleen, because all of it is getting collected in the body. So it causes ascites, that is GIT enlargement, enlarged liver and spleen. Also distended jugular veins, increased JV pressure, peripheral venous pressure is also increased, causing swelling in hands and fingers, dependent edema in the feet and the ankle because of the accumulation of fluid, anorexia and complaints of GI distress, distended jugular veins, and maybe it is secondary to chronic pulmonary problems. Why? Because the pulmonary problems occur due to the left-sided heart failure, which then causes chronic pulmonary problem leading to right-sided heart failure. Now, in a left-sided heart failure, the patient has paroxysmal nocturnal dyspnea, has pulmonary congestion, coughs, crack, wheezes, blood-stained sputum, also present tachypnea, elevated pulmonary capillary wedge pressure, and the body is unable to breathe properly. There is orthopnea, tachycardia, exertional dyspnea, fatigue, cyanosis, confusion, restlessness, because body is not getting perfused or oxygenated appropriately. So there is hypoxia and there is hypoxemia as well, which leads to orthopnea, tachycardia, dyspnea, exertional dyspnea, paroxysmal nocturnal dyspnea, restlessness, confusion, pulmonary congestion in the lungs, coughs, crackles, wheezes, etc., fatigue, breathing in left-sided heart failure. Now, the pathogenesis of this heart failure results from a variety of cardiovascular conditions, including chronic hypertension, coronary artery disease, and valvular disease. As heart failure develops, the body activates neurohormonal compensatory mechanism. Systolic heart failure results in decreased blood volume being ejected from the ventricle. The sympathetic nervous system is then stimulated to release epinephrine and norepinephrine. Decrease in the renal perfusion causes renin release and then promotes the formation of angiotensin 1. Angiotensin 1 is converted to angiotensin 2 by ACE, which is the converting inhibitor enzyme, which constricts the blood vessels and stimulates aldosterone release that causes sodium and fluid retention in the body. There is a reduction in the contractility of the muscle fibers of the heart as the workload increases further. Compensation: the heart compensates for this increased workload by increasing the thickness of the heart muscle. So what do you do as a nurse in the nursing management of a patient of heart failure? Despite advances in the treatment of heart failure, morbidity and mortality remains very high. Nurses have a major impact on the outcome for patients with heart failure. Based on the assessment data, the major nursing diagnosis for the patient with heart failure includes the following. That is, there is activity intolerance due to increase in CO, related to decreased carbon monoxide in the body and increased carbon dioxide in the body, excessive fluid volume related to the heart failure syndrome, obviously, anxiety related to breathlessness from inadequate oxygenation, powerlessness related to chronic illness and hospitalizations, ineffective therapeutic regime management related to lack of knowledge. The care plan necessary for heart failure focuses on promoting physical activities, reducing fatigue, relieving fluid overload symptoms, decreasing the anxiety, increasing the patient's ability to manage anxiety, encouraging the patient to verbalize his or her ability to make decisions and influence outcome, and teaching the patient about self-care programs. That is, after release or after discharge from the hospital, so how can you manage your symptoms? How can you prevent further exertion? Or how can you promote physical activity in the patient without exerting the patient, reducing the fatigue, relieving the fluid overload symptoms, and decreasing the anxiety associated with the same. Also encouraging the patient to verbalize his or her ability to make decisions and influence the outcome is also included. is also included as a part of a management of heart failure, so that the patient is able to promote self-care on his own. Now, for the nursing intervention that could be developed for this is promotion of activity tolerance. A total of 30 minutes of physical activity every day should be encouraged, and the nurse and the physician should collaborate to develop a schedule that promotes the same. Spacing and prioritization of activities. Management of the fluid volume in the body is very important, should be managed and monitored closely, auscultating the lungs, monitoring daily body weight, increase and decrease, fluid loss in the body, assisting the patient to adhere to a low sodium diet. Controlling patient anxiety also. Exhibiting anxiety when the patient's nurse should promote physical comfort and provide psychological support, and begin teaching ways to control anxiety and avoid anxiety provoking situations. Minimizing the powerlessness as well, encouraging the patient to verbalize their concerns and provide the patient with decision making opportunities. Nursing priorities should basically consist of improving the myocardial contractility, reducing the fluid volume overload by checking the fluid testing, assessing the amount of fluid intake and exit, preventing any complication, providing information about disease prognosis, so that therapy needs and prevention of any recurrences as well. That is the main priority, that there should be a prevention of recurrences. So a proper care plan should be given to the patient as per the nursing priorities identified, so that they are able to manage their condition at home as well, and a proper checklist can be. Evaluation. So if you want to evaluate whatever your interventions have they been working effectively or not, which will need demonstration of tolerance for increased activity, maintenance of the fluid balance in the body, reduction in the anxiety of the patient, decidedly soundly regarding treatment. The patient is being able to decide soundly concerning his own care and treatment, and there is an adherence to self-care regime as well. Thank you so much. I hope you've understood the topic of heart failure today, how left-sided heart failure leads to pulmonary congestion causing right-sided heart failure as well, and how it affects the patient in terms of the symptoms, and what are the different types of symptoms and pathogenesis in both left-sided and right-sided heart failure, and how we can as nurses manage the situation and help in maintaining the fluid balance and controlling the anxiety in the patient, and also promote prevention of any further attacks of the same in the patient. I hope you've understood today's topic appropriately. I hope to see you next time again. Thank you so much.